Hey guys, this is Dr. O'Malley with Great Oral Health. Today I want to talk to you about proper tooth brushing. You know, you go to the dentist, and as a dentist myself, holistic, cosmetic, reconstructive dentist, it doesn't matter. You go see a dentist, and for some reason, some hygienists are taught one way, another one's taught this way. But I've found the best way to keep the teeth and gums healthy is a specific way to brush your teeth, and I'm going to show you an example of how to do it on a model that I have here. It's a model that was famously used in my free holistic dental course.com course that we sent out to tens of thousands of people have signed up for free to get educated on the latest and greatest in dentistry and etc. But this model, I'm going to show you how to really brush your teeth properly and clean around the gum, because it's the gum tissue itself that acts like it's like a turtleneck, the way it wraps around our teeth, and we have to clean inside the turtleneck. And the bristles need to go down in there and clean all that plaque and all that debris out of there that accumulates. Our mouth has more than 700 different species of bacteria that coexist with us, and a lot of them have various functions, and they help in the breakdown of various amino acids to help convert to nitric oxide in the body. Nitric oxide is that one that helps keep our arteries flexible. And if a person kills all the bacteria in their mouth, well, you would think that would be perfect, but evolution has created this nice symbiotic relationship. So basically we want to create a balance. Mostly the good, even some of the pathogenic, harmful ones can be in low numbers, and they seem to help in detoxifying the body from heavy metals and those types of things. So you want to create a balance. Mechanically though, how do we clean the teeth so that we're really massaging the gum, that turtleneck area, and getting everything cleaned out? So first of all, you want to get a nice toothbrush, and you want the bristles to be soft. It's very important that the bristles are soft. If you start working with a medium or hard toothbrush, you might think you're cleaning better, but you can start sort of eroding away the precious enamel. The enamel is rather plastic. In other words, it's hardening and softening, rebuilding all day long. So you eat something very acidic and it becomes rather soft, and the body over 20 minutes buffers it and remineralizes that area. So it's really important that you get to the point to where your brushing is appropriate with a soft toothbrush. Next, I'm going to teach this in 4 areas that a person is going to clean their teeth. So this being the upper teeth here, you want to make sure you're cleaning the upper outside. You can start on the right side of the mouth and go to the left side. You want the toothbrush angled so it goes straight against the teeth. So you want it to be angled. So here we go, straight on. This is straight on here, and then you want it to be angled upward, and then you are vibrating. It's a vibrational motion as you're cleaning. That's the first motion. So you do the upper outside, then you're going to go to the inner inside, and again you put it flat and then you angle it. So if it's the upper teeth, you angle it downward into the gum, and then you come all the way around and you prepare this, and you can get each tooth in the front one at a time, and then you go angle again this way, and you're going to get all the way in the back. So now you've done those 2 vectors, 1 and 2. Then you're going to come down. Now you've just finished coming back here, so let's just go down to the bottom. So on the bottom, the bristle goes in again at a right angle, and then it angles down. So whichever, you put it flat against the tooth, and then it angles down on the gum tissue. And so we're going to vibrationally clean that and come all the way forward again, and then we go all the way around, and we're going to clean into the back. And you can take a moment to do that. So you'll actually see, if you look closely in there, when you're pushing down against the gum, it'll actually turn the gum white, because you know you're stimulating the gum tissue. That's really what you want. Okay, so now we've done that outside. Now what do we got left? We have only a 4th segment left, and that's the lower inside. And you're going to lay it again there, angle it down toward your gum vibrationally, and then clean the individual front teeth. You can really clean these. This is where all the stain accumulates, and tartar for people builds up. That's hardened plaque that becomes sort of calcified. It's kind of like the coral in the sea. So you had bacteria living there. They leave their deposit. It becomes calcified and becomes rather thick. And when you see the hygienist, she goes in with their special tools and picks, etc., and starts chipping little bits out if you haven't had your teeth cleaned in a while. Okay, so now we've cleaned all 4 segments: upper out, upper in, lower out, lower inside. Now we're going to close our mouth down, put the toothbrush in, and we're going to squish it between upper and lower teeth, right in the middle, as if we're trying to squish it through the teeth. And you're going to, again, vibrationally go all the way around the mouth this way to the other side. This might take a minute or so to do this whole thing. Then if you want to clean the other areas, the surfaces of the teeth, you can spend a little time cleaning the surface of the teeth and giving them a once over even again. But mainly you've hit those 4 main vectors, and those are the areas where the body doesn't clean real good. The body, the way it's designed, when we eat, drink, and swish our mouths, most of the tooth structure that's exposed is self-cleansing. Where we end up getting cavities is between the teeth, where we floss or don't floss, and also down near the gum line, because a lot of people are brushing this way, where they're brushing down very softly. They're not stimulating that turtleneck area of the gum tissue, which is really what you want to do. And so the other area that you want to keep clean is the back of the tongue. So you can clean the back of the tongue with the toothbrush, and you can also use a tongue cleaner, which I have here, and I'll show you. This is a tongue cleaner, and you want to get a design that's nicely beveled so that it's not sharp. And you go back and back of the tongue, and you pull forward, back, pull forward. You're sort of scraping any of the junk that can build up over time there. And that's a really important tool. So now you've learned how to brush and clean the back of your tongue. And on another video, I'll go over flossing so that you properly floss your teeth. But believe it or not, if you master this, you're going to have far less cavities and far less problems with your teeth in the long run. This is called the modified Bass technique. And I don't know, some dentist who was a fisherman maybe came up with that information. I'm not really sure, but it's called the modified Bass, and this is the one that I recommend, and it's the example that I just showed you how to do. And I hope you have great oral health for life. That's my goal. Not only for you, but everybody out there that's watching, listening, and those that haven't yet learned about this. Share the news, have them tune in, have them learn too, because tooth decay and gum disease can be a thing of the past if we get the proper tools and the proper ingredients of which to handle our own daily hygiene. And if you have healthy, happy, strong, clean teeth, clean mouth, clean tongue, the rest of your body seems to respond very well and stays very strong, happy, and healthy as well. So here's to great health. Here's to great oral health. Thank you very much.